My speech will start in 3, 2, 1. Deep breath in, deep breath out. Imagine smoking 15 cigarettes a day. That is 5,460 a year, which, according to the World Health Organization, that costs you 75 days of life every year. Yet, millions are losing those 75 days without ever lighting a single cigarette. Because chronic loneliness damages the human body as severely as smoking 15 cigarettes a day. I want to do a couple of things in this speech. First, I'm going to show you how loneliness has infiltrated modern life and become quote unquote normal. Second, I'm going to reveal what loneliness is doing to the human body and brain in ways that we can no longer ignore. And finally, I'll show what actually works by treating loneliness as a healthcare crisis, prescribing social connection, and teaching emotional literacy before silence turns fatal. But before the stats, studies, and science, let me show you how these happens. Let's imagine a person. Let's call her Laura. Laura wakes up to the dim blue glow of her phone. Before she stretches or opens the curtains, her thumb is already scrolling. She showers with a podcast, not to learn, but to avoid the quiet. She eats breakfast with YouTube, not for entertainment, but because silence feels uncomfortable. She sits on crowded trains, surrounded by people, yet speaks to no one. By the time she gets home, after a full day of people, noise, and conversation, she realizes something unsettling. The only voice she truly heard all day was the one in her head. Laura sounds specific, but she isn't. Her routine is replicated by billions. So when I say my name is not Laura, what I really mean is this. Based on how we live, how we scroll, and how we substitute noise for presence, we could be Laura. Leading to my first point, how loneliness became normal. According to the World Health Organization, 1 in 6 people worldwide experiences significant loneliness. Among young adults, that's more than 1 in 2. Loneliness is no longer an individual emotion, but a structural condition of modern life. 2 shifts explain why. The first shift was digital. Technology promised the so-called connection. However, in reality, what it delivered was constant stimulation without emotional depth. Global time use data shows that the average adult now uses over 6 hours a day on screens, while face-to-face social interaction has declined by 40% since the early 2000s. That wouldn't matter if digital interaction replaced real connection, but it didn't. According to the Pew Research Center, despite more messaging, more platforms, and more connectivity, people constantly report feeling less emotionally supported, not more. Why? Because digital media is engineered for speed, not listening, reach, not depth, attention, not attunement. Psychologists call this the paradox of hyperconnectivity, which means the more ways we invent to communicate, the less connected we feel. So we became reachable, but not felt. The second shift was cultural. Political scientist Robert Putnam documented decades of decline in clubs, volunteering, religious participation, and informal social gatherings. Follow-up research shows that participation in community groups has fallen by 25 to 50% across many developed societies. This matters because community provide low-effort, repeated human contact, the exact conditions under which belonging forms. Remove those conditions and loneliness grows by default. So, by putting this sheaf together, digital substitutions for presence weakens real-life bonds and collapse community. loneliness stops being surprising, but inevitable. Delving into my second point, how deadly loneliness really is. The US National Institute of Health reports that chronic loneliness increases the risk of premature death by 32%, heart disease and stroke by over 30%, major depression and dementia by nearly 50%. A mortality impact comparable to smoking 15 cigarettes a day. And according to the World Health Organization, loneliness contributes to over 870,000 deaths every year worldwide. That is one death every 40 seconds. But what really happened in our body that leads to these death-threatening stats? When the brain senses prolonged isolation, it doesn't think I'm sad. It thinks I'm not safe. So it triggers the stress response like a fire alarm that never shuts off. Cortisol floods the body, blood vessels stiffens, inflammation spreads, immune system weakens, and at the same time, the brain rewires itself. Fear centers become hyper alert, and silence feels like rejection. So people stop connecting, and the withdrawal deepens loneliness. This creates a biological loop. Stress feels isolation, isolation feels stress, and the body slowly breaks down. Neuroscientist John Cacioppo once warned, loneliness kills by convincing the brain that no help is coming. And so, once the brain believes that notion, people start reaching out even when help exists. Coming up with my third point, our remedy. Our solution must operate at 3 levels: the healthcare system, the social infrastructure, and the emotional skills we teach people to survive. First solution, loneliness as a healthcare crisis. The United Kingdom became the first ever country in the world to appoint a minister for loneliness after discovering that 9 million Britons were chronically lonely. They did something radical. They stopped treating loneliness as a private feeling and started treating it as a public health risk. Clinics began screening for loneliness, just like blood pressures or diabetes. Governments funded over 2,000 community programs designed specifically to rebuild human connection. And the results were extraordinary. Doctors' visits fell by 28%, community participation soared by nearly 70%, severe loneliness declined nationwide, and every pound invested saved up to £4 in future healthcare costs. So the evidence is crystal clear. When loneliness is acknowledged as a healthcare crisis, connection becomes policy. Health improves, communities rebuild, and lives lengthen. Heading up with my second solution, prescribing social connection. Now, let me be specific. Social prescribing is not a poetic language. It is an operational healthcare model used across England, Wales, the Netherlands, Australia, and parts of Canada. When someone walks into a clinic today, we don't wait for them to ask for help with blood pressure. We measure it. Social prescribing applies the same logic to how we treat physical illnesses. In systems that use it, a doctor doesn't just ask, "How are you feeling physically?" They also ask, "How often do you feel isolated?" A short screening identifies risk, just like screening for diabetes or depression. And here's the crucial difference. Instead of saying, "You should try to be more social," the system takes responsibility. The patient is referred to a link worker, a trained professional whose job is not medicine, but connection. And they match the person to a specific structured social activity like community gardening project or a shared meal program. Therefore, connection becomes the default, but not the burden. Here comes my third solution: emotional literacy. As we know, prevention is better than cure. Precaution matters as much as treatment. Many people suffer in silence, not because they feel nothing, but because they don't know how to name what they feel. The "I'm lonely, I'm struggling, I need help" are hard to say it out loud. This is especially deadly for men. Across nearly every country, men die by suicide at significantly higher rates than women. Not because they feel less, but because social norms teach them to express less. So, teaching people, especially young people, how to recognize distress, how to ask for help, and how to build healthy relationships turns quiet suffering into visible need. And visibility saves lives. When people have language for their pain, they don't have to disappear to escape it. So, here's my call to action. Look up, reach out, stay. 3 actions, simple but life-changing. Because loneliness is not healed by one grand gesture, but softened by ordinary kindness offered constantly. A check-in message, a shared meal, a gentle, "Hey, you crossed my mind today." So I have a small task for all of you today. Tonight, before the day ends, reach out to one person. Just one. Someone you haven't spoken to in a while. Someone whose silence feels unusual. Someone who may be holding their breath in a quiet, lonely room. Tell them, "I thought of you today." Loneliness, just like 15 cigarettes a day, can steal 75 days from our body. But one act of connection, one message, one reach, one presence can give years back to someone's soul. And maybe it might save yours too. Thank you.